Hey y'all, this is Dr. Tosha and I'm back with Dr. Tosha After Dark. Today we're going to talk about HPV. Now y'all know I make everything funny, but at the end of the day, let me be very clear that HPV is no real laughing matter. It's a very complex topic that I think that doctors are not real good at explaining. Okay, so I'm just going to tell you what I tell my patients. All right, so when it comes to HPV, HPV stands for human papillomavirus. Okay, and HPV can only be in certain parts of the body, like your mucous membranes. They say, well, you have squamous cells, but your mucous membranes. Okay, and you say, why is HPV such a big issue? HPV actually affects 90% of the population. So people are coming over, I got HPV. Girl, everybody got HPV. What's your next problem? And so the issue with HPV is that there are two different types of HPV, high risk, low risk. But when it comes down to it, there are over 200 types of HPV. The low risk HPV is genital warts. Not, somebody would say, well, I think it's a big deal. Not much of a big deal. But the real issue, HPV, is high risk HPV. Okay. Now, when we deal with high risk HPV, the reason that ultimately it is such a big deal is because it can go on to cause multiple cancers. Okay. Now, when we're talking about HPV, the absolute worst case scenario, this is the worst case scenario. This usually does not happen. It only happens about 3% of the time, but it can go on anal cancer, cervical cancer, throat cancer, vaginal cancer, vulvar cancer, all that. Cervical, did I say cervical? Oh, penile cancer, all that. Okay. And so at the end of the day, let's go back a little bit. All right. Now, when it comes to HPV, how do you get HPV? A lot of doctors be like, oh, it's a sexually transmitted disease. Technically, it is, but I call it a sexually transmitted situation. And the reason I do that is because you get HPV from having unprotected sex. But it's not like a gonorrhea or chlamydia or trichomonas where somebody did something wrong. Nobody did anything wrong. It is a virus that is in the semen, and as you have unprotected sex. So it's not sex in general. You can have all sex in the world. If you wear a condom, you ain't fitting to get HPV. Okay. But then when we think about HPV, we have to think about all the things that come along with it. Now, when it comes to HPV, and let's be very clear, how do you prevent HPV? You don't have unprotected sex. That is how you prevent. But we can get in front of it a few different ways. You realize that there is a vaccine. It's called Gardasil 9. Gardasil 9 actually protects from about four of the major types of HPV, but it covers 9 types, if that makes any sense. So the best time to get the Gardasil vaccine, the best time to get it is before you're even exposed. So mothers, please get your sons vaccinated for HPV. Mothers, try and get your daughters vaccinated before they become sexually active. Your best protection is before you even become sexually active, okay? And we'll talk a little bit as to why. Why? Because Gardasil is not going to take away any types of HPV you already have. If you have it, Gardasil is not going to take it away. If you don't have it, it will prevent you from getting it, okay? Now, how does it work? You say, well, it only takes care of 9 types, and you told me it was 200 types. Yes, but we know those 9 types are most definitely associated with cancers. Not as if you have one, you'll get the cancer, but if you get the cancer, 9 times out of 10, you got one of those 9 types of HPV, okay? Now, of the other 191 types, it is not going to necessarily prevent it, but it will keep it under control. It will keep it, because if you think about HPV, I'm a very visual doctor, right? So I try to have my patients think about things like this. HPV is like an avalanche. What does that mean? So you have sex with guy number 1. He has types 1 through 10, unprotected, of course. Now you got 1 through 10. You have sex with guy number 2. He got types 11 through 20. Now you got types 1 through 20. You have sex with guy number 3. He got type 21 through 30. Now you got types 1 through 30. You see what I'm saying? So the more types of HPV you have, the stronger it gets, and it becomes like an avalanche. Okay. And then we start to have problems with our pap smears. Then we start to have biopsies. So many different things happen and can occur because of HPV, and it's an avalanche effect. So yes, what we want to do is prevent that avalanche type of effect. We may not be able to prevent the actual other types of HPV, but we can sure prevent how strong they get and how active they get, if that makes any sense. I hope it does. Okay. So let's talk about this. When we say HPV is in semen, this is why it requires y'all being real honest when you come to the gynecologist, and that's on Mary, Jesus, and Joseph, okay? I need y'all telling me the truth up and real. Why is that? And I encourage my patients, I need you to come and be like, Doc, okay? I'm in the booty with it. I'm having a little anal in these streets. We back there. I will do an anal pap smear because, again, HPV can affect the anus, and it's back there, it's growing, don't nobody know, ain't nobody checking for it, and now we're developing an anal cancer, okay? And you may not know until it's further along. Also, I may send you for a colonoscopy a little bit sooner. They may want to biopsy if they see some stuff or whatever the case may be, but let me know, because I will pap the vagina and pap the booty real fast so that we'll know. And the times that I've done that, we did find HPV and we had to send somebody to a specialist. Nothing, it was just an observation thing. But the reality is you want to get eyes on that thing quick. And I do usually recommend go ahead on and get your HPV vaccine. What's the problem? Okay, it's 3 shots over 6 months. Okay, so usually we do 1 shot, wait a month, do a second shot, wait 2 or 3 months, and then do your 3rd shot. Okay, so I am all for the HPV vaccine. Why not? A lot of people are like, oh, it was problems with it. What problems? Don't worry, I'll wait. What problems? This was like 30 years ago when we first started getting it, and I think 1 or 2 people passed out. Well, did they pass out because they got the damn shots and they were scared of needles? Or did they pass out because of the shot? We don't really know. But the reality is once you get the shot, they give it at the pharmacy now. Like, you have to ask your doctor, though, but they give the shot at the pharmacy. That's how benign of a thing it is. Now, people say, I'm too old for that. No, the shot is for ages 9 through 45. You hear me? 9 through 45. So you can be 43. Your insurance company is supposed to pay for it. If they don't, get on that horn and be like, why are y'all not paying for my cancer prevention? Period. Because they're supposed to be. I feel like it's never too late. You understand what I'm saying? I feel like, please get into this. And, all the things you say, well, what can I do if I have HPV? Let's talk about that. So normally, HPV, because it's a virus, it can be cleared by your immune system, but it only clears up until age 31. After age 31, if you got it, you got it. Okay, and it's nothing to be afraid of. Again, if you're 35 and you still got HPV, please get your vaccine because, again, it's going to keep it under control. Okay, so up till age 45, get the vaccine, please, please, please. Second of all, go for your screenings. Now, I am a doctor who does not subscribe to these recommendations because they're recommendations. Why do you think they call it an annual? Because you're entitled to it every year. All this 3 years for this, 5 years for this. That's not my ministry. That is not my ministry, and not if you're my patient. Sorry. The reality of the situation, you can go from a normal pap smear to a completely abnormal pap smear in 3 years. So you left here with a normal pap smear, you back and you got a high-grade lesion. No, ma'am, we're not doing that. So in my practice, again, these are recommendations. You got to look at who these recommendations come from too. But at the end of the day, we still do annual screenings at my practice. And they say, oh, we have great control of cervical cancer. We don't need to do annual screenings. Why do you think we have great control? Because we do annual screenings. So I'm not willing to falter on that. Now, there are some situations, somebody don't have a uterus, they had a hysterectomy due to fibroids, non-cancerous reasons. I will skip. I'll do every 2 to 3 years for them. But the doctors will be like, oh, you don't need a pap smear anymore. No, ma'am. No, ma'am. We don't do that over here. We're papping. That's just how I feel. If there's something that's going to prevent the chance of cancer, why not do it? So, anywho's. Now, with the HPV, again, you can clear it up to age 31. But how do you control it? Just like anything else, keep your immune system as tight as you possibly can. Make sure you're having a standard diet, not full of processed foods, full of fattening foods. Eat balanced meals, drink plenty of water, get rest, take vitamins, do the vaccine. And when you do these things, I think that your immune system strengthens, which keeps control of the HPV. Okay, so a lot of questions. Why? I mean, here's this. Okay, HPV is not rocket science. So I'm going to go ahead and break it down. You say, well, why anal cancer? Because people have anal sex. People have vaginal sex, which then the semen hits the cervix, so we're affecting the cervix and the vagina. Okay. Anal sex, we're having anal sex. Head, no, what is it? Head and throat, or what do they call it? Oral pharyngeal cancer, which is basically throat cancer. Well, because there's oral sex. Women have oral sex, males have oral sex. And that HPV get the growing baby. And it's a whole situation. And the vulva is the lips. Obviously, semen is going to touch the lips of the vagina. It's going to drop, it's going to leak out of the vagina. However you want to say it. Any area that is going to be directly exposed to semen that is the mucous membrane, you may develop consequences of HPV. So it is very, very important, in my opinion. So the first thing you can tell somebody to do is have protected intercourse. And let's get to the meat and potatoes of it. I feel like, real talk, as a female, and I'm not judging, I don't need to judge, but let me just tell you what I tell my patients. Why are you giving somebody wife privileges and you may not be a wife? Like, and outside of that, outside of, let's put the wife thing aside, because that doesn't even matter. I feel like it's a bad business deal. So let me get this straight. You're going to have all the fun, because sex really don't feel much different for you. As long as he's hard, it's pretty much going to feel the same. Maybe a little warmer without a condom, but it's pretty much going to feel the same. But it's going to feel like a total different experience for him, whether he has condom or no condom. Okay. So he has a total different experience because of no condom. That's a risk for you, though, because we're risking HPV, we're risking HIV, we're risking all types of STDs, and we're risking pregnancy. And what do you get out of the deal? Right. It's a bad business deal. As an entrepreneur, as a person, as an individual, like, don't make bad business deals. Okay. Because if somebody said to you, come here, sis, give me this $20. You gonna spend this, you gonna play roulette with me, but you ain't gonna win. There's no win for you, and there's no benefit for you. But give me your 20, let's play anyway. You'll be like, hell no. But it's essentially what you're doing. So I don't care whether you wife, girlfriend, this, that, and the third, make good business decisions. And it's okay to have that conversation with your boo, to be like, so have you had an HPV vaccine? Oh, okay. There's no test for males for HPV. We just assume that they're positive. We're just going to make that assumption. There is no test. The only thing we know is whether he's had the vaccine or not, but there's no test to see whether he's HPV positive. Okay. So that's another thing. You can't be like, well, can he get tested? No, there's no test. Okay. So one of the most important things that you can do is be proactive and have these conversations, and say, hey, listen, what are we going to do with these condoms? Have you had an HPV vaccine? Like, do you have unprotected sex with other women? Sometimes they'll tell you the truth, but for the most part, but as far as you're concerned as a woman, there are a few things you can do. Again, have protected intercourse until the situation, as best you can assume, allows for something different. Do the vaccine, live a healthier life, make sure you're taking supplements, and please, and when I say supplements, I mean regular multivitamins. Again, guys, please stop getting taken in by these different companies and these different scammers. There is no supplement that is going to prevent HPV. There is no supplement. There's nothing you're going to buy off of anybody's shop, TikTok shop, Instagram, Facebook. There is nothing out there. It is clean living. It is healthy living, and the vaccine may help some as well. Okay. So please don't get taken in by any quick gimmicks, or, oh, this is going to fix the problem, or this herb is going to prevent HPV. No, that herb may stimulate your immune system. It may help with your immune system, may help with your immunity, and that may help in turn with the HPV, but there is nothing out there that is going to per se get rid of the HPV. Now, I do want to be clear that all HPV does not proceed to cancer. Only 3% of the time it does. But if you do have HPV, especially one of the higher risk HPVs, and we'll talk about what that means, then we still got to do surveillance. So the highest risk HPV is 16 and 18. Okay. 45 is also up there. 16, 18, and 45, them girls. Them are the girls. Now, let's say your pap smear is still normal. You got a normal pap smear, but you got HPV 16, 18, and 45, you actually have to go for a colposcopy. And let me explain the difference. Did you realize that a pap smear is only a screening test? It's a screening test. It is not the actual test. The pap smear says, hey, let's screen this person to see if we see any abnormal cells that could lead us to think that maybe, just maybe, this person is at risk for cervical cancer. If your screening comes back normal, it comes back normal. But if your screening comes back normal and you got HPV 16, 18, or 45, we're going to do the test. The actual test is called a colposcopy. And that's when we bring you in, we put some solutions on your cervix to say, what did this screening see? What's happening here? And your cervix will sometimes react in a particular way. And then we'll biopsy. Little biopsies the size of an ink pen tip, nothing major, but itty bitty little biopsies. We send those to the lab and it tells us exactly what's happening with your cervix. So that is the actual test. Well, most people don't progress to the test. They're cool with the screening, okay? But if you got one of these vicious types of HPV, baby, you skip right over that screening, right to the test. I'm just letting you know, because we got to keep an eye on that, because we know that girl gets real active, okay? So the reality of the situation is, when it comes to HPV, unfortunately, it's the luck of the draw. It's an occupational hazard, whether the condom broke or whether we weren't wearing condoms. If we get HPV, the best thing we can do is try to strengthen our immune system, try to live the healthiest life that we can live to keep our immune system strong, and get the vaccine to try and keep it as controlled as possible. Make sure you are not missing your screenings, ladies. Don't miss your screenings. Like I said, in my office, it's every year. You can do the suit yourself. I don't care what the recommendations say. It's once a year you get screened. If you have the 16, 18, and 45, unfortunately, you'll have to have the biopsy, and we'll kind of keep an eye on where things go with that. And the best thing you can absolutely do is please have protected intercourse. Again, don't make a bad business move. Don't make a bad business decision. And I call it bad business decision because, like I said, put it on paper. Take it away from sex. Take the emotion away from it. Take the whole sensuality. Take the intimacy away from it. Put it on paper as a business deal. Put it on paper as a math problem. You have assumed all the risk. You've gotten minimal benefits. And then it's just like, that's on you. So would you really do that in a situation other than sex? Likely not. So it shouldn't be much different for sex. And that's just really how I feel. Like I said, very few of these cases, only 3% of these cases actually go on to become a cancer. But unfortunately, when we do see that the cancers that are, throat cancers, anal cancers, cervical cancers, vaginal cancers, because of the type of cell it is, because of the type of tissue it is, it can really, really be devastating. That's why I'm so big on screening. Don't be afraid. Don't come in, because my patients know what we doing. What's happening in these streets? What's new in the streets? What you doing? You got a new partner? Have you seen his testing? Have you gotten him tested? What kind of sex y'all having? Because it's important. I'm not being invasive. I need you to be honest. And it's perfectly okay if you have an anal sex. That's not my judgment. Let me just fix you. It's perfectly okay if you bust down and you a freaky girl and you swallow. That's fine. Do what you got to do, sis. But let me know, okay? Because we'll get some screening done. We'll do an EGD. We stick a camera down your throat and take a look and see if we got any issues with HPV. So as long as you're honest about the kind of sex you're having, and I don't care who you having it with, that ain't my business. But if you're honest about the kind of sex you're having and what you're doing and how you're doing it, oh, sis, we can help you. We can have optimal screening, and we can make sure that you stay good. So anything that pops up, we'll find it early stage, and we'll be able to get in front of it and deal with it. Does that make sense? Okay, I hope that makes sense. Now, the one thing I don't like, again, when it comes to trust in the medical community, because people think that doctors are like these magical figures that are just so mythical and wonderful. Doctors are people. Okay, let me be clear. Doctors are people with all the bullshit and baggage that anybody else might have. And sometimes, and a lot of times, I don't like a lot of times how people are counseled, because like, oh, you have HPV, and they make it like it's so dirty, like it's an STD. Sometimes people have superiority complexes, like, they're so much better than you, or whatever the case may be. And I don't like it. That's how I'm like, okay, hold on. Let's talk about HPV, because it ain't like gonorrhea or chlamydia. Yeah, we kind of get it the same way, but let's just think about it differently. Okay, so it's just one of those things that I like for people to be educated about when you go to the doctor's office, because I have a lot of people who are like, I haven't had sex in 3 years because I got HPV. Girl, girl, if you don't sit down somewhere, because anybody who you gonna have sex with got HPV, and if you're that worried about it, just put on a condom, because that stops everything. Okay, so if you do have HPV and you got a self-esteem problem about it, put on a condom. If you're in a long-term relationship, girl, he had HPV when you met him. You probably had HPV when you met him, and it is what it is. So don't let that stop you from, your flow or whatever. What you need to be more concerned about, need to be more pressed and impressed about, is the overall and the long-term implications of HPV, which again are going to be your abnormal testing, which is going to cause you more issues with testing and biopsying and pain and bleeding and having discomfort and all the things that come along with screening and testing. Okay. So at the end of the day, what I want you guys to make sure of is that you're doing the very best you can to prevent HPV. But if you get it, hey, it's okay. Let's pray we clear it. If we don't clear it, let's just make sure we get vaccinated, and let's make sure we're getting our annual screening. Please be honest. One of the biggest things that I feel we fail in the OBGYN community is sexual history. Like, we're not getting a sexual history. And it's like, it's not because of anything you guys are doing. It's because I think a lot of the time the doctors are uncomfortable being like, so do you have anal? Okay. So do you do blowjobs? So, and I think it's very important that those questions come up, because oftentimes you guys are uncomfortable discussing it. And so the doctor's not going to discuss it. So the reality of the situation is that, there's a disconnect. And that disconnect can truly cause you guys some consternation and some issue. So the reality of the situation is, like I said, prevention is key. Condoms, prevention is key. And then outside of that, we're going to do the vaccine. We're going to make sure we keep up with our immune system. We're going to make sure we keep up with our screenings. Okay, and then we're going to be honest about our sexual health. All right, so I hope this blessed somebody. This is Dr. Tosha Rogers back with all about HPV. Thanks for tuning in.